All right, today we are diving into one of the most incredible paradoxes in all of modern medicine, cardiac surgery. Think about this for a second. To heal the heart, to fix it, surgeons have to do something that sounds completely backwards. And right at the heart of this incredible balancing act is the anesthesiologist.
That's the big question, isn't it? The heart is this powerful muscle, constantly moving, pumping blood to every single part of your body. So trying to perform incredibly precise surgery on a moving target like that, it seems, well, pretty much impossible.
And there's your answer. The surgical team has to create a perfectly still, quiet field to work in. And they do that by stopping the heart completely. But wait, if the heart isn't beating, how does the patient survive? Well, that's where the real magic and the deep science of cardiac anesthesia begins.
Okay, let's get into the details. Long before the first incision is made, the anesthesiologist is basically like mission control. They're gathering a ton of information, getting the patient ready for that critical moment when their own heart and lungs will be taken offline. It all starts with getting a crystal clear look inside. They do this with an amazing piece of tech called a transesophageal echocardiogram, or TEE for short. Just think of it as the team's live internal camera. A small probe goes down the esophagus, and because it sits right behind the heart, it uses ultrasound to give them this beautiful, real-time picture of everything that's going on. This view is absolutely vital for guiding critical steps, like making sure the tubes that connect to the heart-lung machine are placed perfectly.
So, with everything prepped and in place, we get to the most crucial part of the whole surgery, going on bypass. This is the moment where, quite literally, the patient's life is handed over from their own body to a machine. And that machine is the cardiopulmonary bypass, or CPB machine. It is the ultimate life support system. What it does is it drains blood from the body before it gets to the heart, runs it through an artificial lung to give it oxygen, and then pumps that fresh blood right back into the body, completely bypassing the patient's own heart and lungs.
Let's follow the blood's journey for a second. It's pulled out of the body into a reservoir, then it's sent to an oxygenator, which also controls its temperature. The blood gets filtered to make sure no dangerous little clots get through, and then a pump, which is acting as the new heart, sends it right back to the patient. For the entire time the surgeon is working, that machine is the patient's heart and lungs. Now here's where things get really fascinating. To protect the brain and other vital organs during all this, the patient's body is often cooled way down. But here's the catch. Temperature changes blood chemistry, especially how gases like CO2 behave. This forces the anesthesiologist to make a really important choice.
So there are basically two main schools of thought here. One is called alpha-stat. That's kind of the go-with-the-flow approach, where you let the blood's pH change naturally as it cools down. The other is pH-stat. That's more hands-on. You actually add carbon dioxide to keep the blood's pH locked in at 7.4, which helps push more blood flow to the brain. The right choice really depends on the patient and the specific surgery.
But the CPB machine isn't perfect, and this really highlights the big trade-off. While this machine is keeping the patient alive, the very act of running blood over all those artificial surfaces kicks the body's inflammatory response into overdrive. It's another huge variable that has to be carefully managed.
Okay, the surgical repair is done. And now we come to the climax of the whole procedure. It is time to wake the heart up and bring the patient's own heart and lungs back online. This is, without a doubt, one of the most delicate, high-stakes moments in all of medicine. Just picture the scene. The surgeon has finished their work on a completely still heart. Now, the entire team, the surgeon, the anesthesiologist, and the perfusionist running the bypass machine, they all have to work in perfect harmony to gently coax that heart back into doing its job. The whole process is incredibly methodical. First, they slowly warm the patient back to a normal body temperature. Then, the anesthesiologist gives the lungs their first gentle breaths. As that warm, oxygen-rich blood starts flowing back to the heart, it starts to beat on its own. Then, very slowly, they dial back the flow from the machine, letting the patient's heart take on more and more of the work until it's doing it all by itself again.
And you know what makes all of that possible? Flawless communication. Every single person on that team is watching dozens of different things at once, talking constantly, making these tiny little adjustments to make sure that transition is perfectly smooth. It is the definition of teamwork.
But just because the patient is off bypass doesn't mean the work is done, not by a long shot. Now, the anesthesiologist's job shifts to managing all the consequences of the surgery.
and the time spent on that machine.
And the number one most immediate challenge they're watching for is bleeding. Think about it. The patient was given a ton of blood thinners to stop clots from forming in the machine, and the machine itself can be tough on platelets and clotting factors. It's a perfect storm for potential bleeding.
And get this, the statistic is just staggering. 50%. Half of all cardiac surgery patients end up needing a blood transfusion. That is a coin toss. And that's a big deal, because while transfusions are absolutely life-saving, they also come with their own risks. So, that raises the big question. How can the team be smarter about this? How can they go beyond just giving blood products and instead provide treatment that's targeted and precise?
The answer, as it is so often these days, lies in technology. Instead of just guessing, modern operating rooms use what we call point-of-care tests to get a super fast and detailed picture of exactly which part of the clotting system isn't working right.
One of the best tools for this is a test called ROTEM. It basically gives you a real-time graph of the entire clotting process. It's like a diagnostic map for the patient's blood. Is the problem not enough platelets? Is it a lack of fibrinogen? ROTEM can tell the team exactly what's needed and, just as important, what's not needed.
And this really marks a huge shift in thinking. The goal today isn't just to stop the bleeding, it's to figure out why it's bleeding and then treat that very specific cause. It leads to better results, and it helps conserve precious blood products.
When you take a step back and look at the whole thing, it really is an incredible orchestration. You have this blend of amazing technology, a deep understanding of the human body, and incredible teamwork, all working together to turn a potential disaster into a controlled, life-saving procedure.
And at the end of the day, success in this kind of high-stakes environment comes down to that complex, many-sided approach. You have to be ready for all the curveballs that heart surgery can throw at you.
It really leaves you with a final thought, doesn't it? We've seen how tools like TEE and ROTEM give us this unbelievable real-time window into what's happening inside the human body. So as that window gets even clearer and our technology gets even smarter, you just have to wonder, how will we redefine the absolute limits of what's possible in surgery?